All right, we're going to go ahead and get things started. So thanks everyone for joining today for the live virtual demo of the OsmoTECH HT, the 96 well plate based osmometer. I will be your moderator today. My name is Carly. I'm the Instrument Inside Sales representative and I cover all of North America. So you may have been interacting with me in the past or might interact with me in the future. And today I'm joined by Rick Zampa, who's our application specialist, and he will be performing the demo today. All right, so just a little bit of housekeeping for today. You'll find the chat button just at the top of your screen, and you're able to answer questions throughout the presentation. We'll take a few pauses throughout to answer some questions, but otherwise there will be a full Q&A session at the end. Also, if you have any issues throughout the presentation as well, feel free to enter those in the chat and we'll try to resolve them as soon as possible. And no problem. And with that, I will kick it over to Rick.
Thank you, Carly, very much. My name is Rick Zampa. As Carly said, I'm the application specialist. I've been with the organization 27 years, numerous roles within the organization and opportunities to work with a number of different people throughout the organization. So taking on this role here as application specialist right now. So let's get started with a little bit of overview of Advanced Instruments and who we are. So we're a 65-year-old or older company that started our business on osmolality testing. We've been the leaders in osmolality testing for the entire time. We've developed the most comprehensive line of osmometers for the biotech, clinical, and food industries. We also have a cell line development technology we purchased last year, or a couple of years ago, and a liquid handling quality assurance system that was recently purchased. We're dedicated to increasing productivity, ensuring quality in the biopharmaceutical industries. We are headquartered in Norwood, Massachusetts, which is just outside of Boston. We have an office also in Westbrook, Maine, and we have one in the Winborne in the United Kingdom. We also are experienced in developing analytical instruments and delivering value to our customers, but we also have over 90 distributors across the world to be able to manage your business regardless of where your facility is located. I know we're talking to the North American customers this afternoon, but I'm sure you have colleagues around the world and we can support them as well through our organizations, throughout our distributor organization around the world as well. So thank you. Okay. Advanced Instruments currently offers 4 different product lines that are utilized in biopharmaceutical space. Today, we will focus on the OsmoTECH products or osmometers, and which is the only osmometer that is specifically designed for customers in the biopharmaceutical marketplace. They are optimized for testing of biological samples such as cell culture media, buffers, and aqueous drugs products. We also offer Solentum products. Oops, that went too far. Sorry about that, folks. My buttons are not working right. We also offer the Solentum instruments and reagents for cell line development. We have the Inoximet product, which is for anaerobic bacterial culturing. And we have the Artel instruments for pipette and automated liquid handling calibration. All 4 product portfolios are supported by our own dedicated Advanced Instruments trained field service engineers. We have service contract options available for you to maintain the equipment, prevent disruption to your work so that you could prevent disruption to your workflow. Specifically for OsmoTECH users in biopharma, we offer qualification and validation services to assure regulatory compliance and help get your instrument up and running quickly. Okay, so now let's focus a little bit on the OsmoTECH osmometers. Let's discuss some of the applications of osmolality testing in biological development and manufacturing processes. Starting with the cell line development and through cell culture scale-up, osmolality can be used to confirm the concentrations of medias, feeds. It can help you gain insight into optimizing your scale-up steps. In downstream in your purification workflows, osmolality is used to confirm buffer concentrations, help ensure buffer exchange, measure the concentration of the drug substance, and finally, in formulation and fill, there's a way to develop. And finally, in formulation from development through fill and finish, osmolality is a critical attribute that provides valuable information about the identity, safety, purity, and stability of the drug products. Finally, for injectable drugs, osmolality is critical to the final solution, as you want to have it in the physiological range to ensure that you don't have any irritation at the injection site, or to ensure that it doesn't cause any pain to the patient. Okay, so here's just a quick overview of selection considerations when looking for an osmometer. Obviously, you want to have an instrument that's easy to use, of course, that's critical, and performance. You want to have the most precise and accurate instrument in the industry, which is what we developed for you guys here today. Volume requirements, obviously very important. This amount of sample you'll need to use to test, particularly when you're in the formulations or early R&D stages where you don't have as much sample available. Testing time, always want to have it done as quickly as possible. And then depending on where you are in the process, be able to meet your data management and regulatory compliance needs. So the OsmoTECH osmometers are built with biopharmaceutical labs' needs in mind, and were designed as a result of your feedback. The testing process is fast and simple to integrate into any customer workflow. They have flexible data connectivity options, strong data integrity features, and the features are adjustable to your lab's needs. So any of the things we're going to talk about later today in the demonstration is completely adjustable for your process needs and where you are in the process workflow. Finally, we have the OsmoTECH XT instrument, which we're not going to be delving into too much today, but the OsmoTECH XT is an instrument that will go from 0 to 4,000 milliosmoles and improve testing performance with viscous or highly concentrated samples. Finally, the portfolio of osmometers here, it currently supports all the different regional pharmacopoeias, such as European, US, Japanese, and many more. It's important to note, too, at this point, that the European pharmacopoeia is having an update in January 1st of 2024, and it may affect some of you or your colleagues if you're sending products over to the European marketplace from your locations. So the OsmoTECH HT, just a quick overview, 0 to 2,000 milliosmol operating range. This time is 90 seconds. It's a 96 well plate format, and we're going to show that here shortly. Takes 40 microliters for one replicate, or 180 microliters to do a triplicates or 3 replicates. As I said, it supports USP, EP, and JP guidelines. Okay, that's the quick presentation so far. If there's any questions, let me know at this point. Okay. Hello again, everybody. Here we are. We have the OsmoTECH HT instrument. I'm going to give a quick overview of the instrument itself here. First thing you'll notice is a large touch screen display here. And that's the first thing you'll be said. And then just below that, we have the loading deck for the 96 well plates right here. And then just below that, we have the drawer. In the drawer is where the system fluid goes for cleaning the pipetting system and the pipette between samples. There's also a waste container here to contain the waste from the pipetting solution. And then there is also a waste receptacle here for your plates and sample cups after each test is completed. So that's the drawer. Then on this side here is the hood. Underneath the hood, and we'll get a closer look at this later, is the osmometer module and the pipetting system. And then finally on the top here is where you load your sample cups in for your sample testing. And the instrument will do 1,000 tests before needing to be refilled with sample cups. So since I'm talking about the consumables now, let's do a quick focus in on our consumables. And you can see this is the bag of 1,000 sample cups, which would go into the hopper at the top there, where we just showed you. Then we have our cleaning reel, and this cleans the sample probe of the osmometer between each test to assure no carryover or any contamination. We have the system fluid bottle, which I showed you is in the drawer there to connect it to the pipetting system. And then we have our test kit, which holds 11 96 well plates like this one. And it holds 22 of these evaporation covers as well to go over each plate when you're running the tests. So it also has one waste bag to go into the waste bin there that's in the drawer. The other thing that the instrument comes with is its own calibration kit. It has the 4 calibrators from 0 to 2000 and 1 bottle of our 290 reference solution, which is used to verify the calibration at the end of the calibration. Calibration is run using this calibration cassette. You load each ampule into its position on the cassette here, open them up, and the 290 reference solution, and it runs the calibration automatically for you and then verifies it with the 290 standard solution. One thing to note about calibration is we would only expect our instruments to be calibrated roughly once per year, and that would only be when your calibrators and controls are out of range or once a year as required. Okay. All right, let's move over to the instrument, get a better look at the instrument now. Here we have our touchscreen display.
We also have one question, or do we want to save them till the end?
No, that's fine. If we've got a question now, we can take it.
So there was a question that if we can do duplicates with 40 microliters.
No, we cannot. We have to, we need 40, the test takes 20 microliters in the sample cup, but we need 30 something to pipette 20 microliters into the sample cup because the pipetting systems always require an extra volume to assure that you get proper and accurate, precise pipetting into the right volume. So we can only do one with 40. Okay. So back to the display here. As you can see, it says Demo HT up here in the corner. This is a field that you can create your own name for your instrument here with this field. You can call it formulation, you can call it QC, whatever you want. It's fully up to you how you want to name your instrument. You have your date and time, shows that the instrument is ready to run. You have your plate layout here. It shows what positions on your plate have been tested or weren't tested or what's available still for testing. You have your load button, you have your menu button, your status bar, and then your test result would be here in the middle. Down here at the bottom, it shows you your consumables levels, what's left in each particular type of consumable, so you know when you're going to need to change your consumables. Finally, you have a small button here that shows if you're connected to your local area network. So that would be there. So now let's talk about how we would go in and set up the instrument before we get started for testing. We're going to go into the menu. And the first thing we're going to do is we want to go into our settings menu. And you'll notice when we get to the settings menu here, you see a bunch of small keys. You see the red key, the gold, the silver, and you'll see they're spaced out around. The red key means that only an administrator can get into that menu. The gold key means a supervisor or an administrator can get in there. The gold and the silver key means that anybody can get into that menu, but you still have to log into that menu. So it would still require a username and a password, but everybody from administrators, supervisors, and operators would have access to that menu. So the first thing we want to do is set up our users, and that's protected only for administrators. So we're going to go in as an administrator. Enter. So you can see on this system, we only have three users set up. We have us as an administrator, we have a service login, and then we have one supervisor logged in. If we want to add a user here at the instrument, we would type in the user ID here, we type in the password, and then we would choose the access level with which we want them to have. One thing I want to note here too is you can connect a USB keyboard to the instrument. So if you'd rather than type into these little keypads, you could connect the keyboard and you could type in that way if you were going to do this from the instrument itself. The other way to add users would be to go into the LDAP or LDAP-S menus here. In other words, to use your Active Directory or your corporate logins or your Windows logins or whatever username and password you use for your computer, you could have that set up as to be the password for this instrument, the username and password for this instrument. Your IT people would come in, set up the groups, put the people into the proper groups, and then you would use your same login from your computer or from your Windows login to log into this instrument as well. If you're doing that, all your password security expirations would all be managed at the corporate level, not on the instrument. However, if you are adding passwords or usernames and passwords on the instrument, you can set up the password strength here in this menu. And you can also set up how long the passwords will be before they need to expire, as well as setting up the different strength levels for for the password itself. Okay. Oh, timeout. No, we don't need to talk about timeout. That's just when the lights dim. So that's the user menu. One of the things you can remember is that all of the data on the system is unlimited storage. So we can have an unlimited number of users in here. We can have an unlimited number of results on the system. It's all has unlimited capabilities, which is part of the features that give you data compliance and integrity. Because if you are being audited and there is a question about a piece of data stored somewhere else, the auditors almost always want to go back to the source of the data to see where that came from, and it would always be stored here on the instrument. We're going to exit out of the users. Once we have our users set up, we want to set up their, and then we have their access level. We want to set up what which each level has access to. Sorry about that. It didn't come out quite right. So what I want to say here is we want to determine which features a supervisor and operator now have access to once we've set up the different types of users in the system. So you can see they have access to just about, the supervisors have pretty much access or can have access to just about anything. The way we have it set up right now, they have a lot of access except for changing accounts and restrictions and things like that. And the operators actually have quite a bit of access the way this is set up as well. If you wanted to change anything, all you would do is hit the check mark, it would come off. So if I didn't want operators to calibrate, I would uncheck that. I'll leave that on right now. And then that would allow you to set up the levels of access you want each person to have. And this is completely configurable by your organization. So the way we have this set up is there's a lot of access to this instrument. In many other organizations where I've seen instruments set up, there's much less access for supervisors and operators, particularly when you talk about changing dates and times and calibration functions. Oh, that's one other thing. The date and the time also can be connected to your SNTP server so that you get the same time on the instrument as your network, so that you're sure that you're coordinating your time between your instruments and your network time. Okay, testing. We're going to go into testing. It's the next menu. So this is where you set up whether you want to require a user ID and a sample ID for testing, and we have it set up where that is required for our testing. We've also enabled administrators to perform tests. This is something that most companies wouldn't do because the administrator is typically somebody who just sets up the instrument. They don't want them running any tests. So they wouldn't allow administrators to do that. But since we're doing the demos, we would like to have that capability so we can all have complete access to the instrument. The other thing is position display. So you can choose to have it number first or letter first off of the plate. So depending on how you like your layout, you can choose the letter first or the number first when it shows you the position on the plate. Finally, we have auditing here. And what auditing is your ability to comply with 21 CFR Part 11 or EU Annex 11. And what it does is this allows you to choose whether you want to have the results reviewed or approved or both or none. So in this particular case, we don't have any review or approval turned on. However, we could turn on just review or just approval, and then we could choose who has the ability to do those approvals or reviews. The other thing that you can do here is you can turn on comments per signature. So you can require that a comment is put with each signature. You can require a reason for change in settings here. What that is for your audit trail. So for compliancy reasons and data integrity reasons, if a change is made to the instrument, it requires that person who made that change to put a comment in there as to why they made that change to the instrument. And then you can record all logins and logouts. So we're going to get a chance to look at the audit trail here in a little bit, and we'll show you just exactly what I mean by all of this to some degree. Oh, finally, accounts, you can allow comments on results. So in the results database, say you put in the wrong sample ID and you noticed it later, and you're going to you want to make note of that in the data, you can go to the database results. You can, if this was checked on, you could add a comment to that saying wrong sample ID, date, and then that would go into your data results database, into all your data, and into your backups and everything, other files that go out. Okay, next thing I want to talk about is data management. So we'll go into this, enter our password. Of course, passwords have to be entered every time to assure that the right person is getting into the system that has access and availability to that menu. So we have our export menu here, and this is where you would manually export any of your data if you wanted to. So you can choose the file type you want to export, CSV or PDF. You can choose both or one or the other. You choose the location, USB. There's a USB connection right here underneath the system. You could plug a USB in there, download any one of these databases there, or you can send it to a network folder. Your IT people would set up the path here for that network folder. You can export any one of these databases, users, controls, events, or results, or you can export them all. System also has a data backup function. As opposed to the exporting of just the databases, the backup function allows you to back up the data, all the databases, the configuration files, all the users, everything, so that if anything catastrophic ever happened to the instrument, you could load that file back in and you could be back to the point of the last backup. So speaking of the last point of backup, you can schedule your backups over here. It's once a day, a week, or a month. You can choose what time of day you want that to be, what day of the week you want that to be. The only thing you have to remember is the instrument has to be on, obviously, and you cannot be running tests while the backup is trying to run. If you're running tests while the backup is trying to run, it will skip that backup and go to the next one where it is not running. We also have a synchronous backup, which can back up from anywhere from every 5 minutes to every hour. And what a synchronous backup is it is one single backup file. So every 5 minutes, it rewrites the backup file and adds anything new to it at that point in time. The scheduled backup gives you a backup file every time it does a backup. So say you were backing up once a week. At the end of a year, you'd have 52 backup files if you scheduled it once a week. If you're using the synchronous backup, you would have one backup file for that year, because it just keeps rewriting that file. Again, you can send that to a USB port or to a network folder. Import. So this is where you would import the database back into the system if there ever was some type of catastrophic failure. Not something we believe will ever happen, but you can do that from this USB port under here or from the network folder where you're storing the backup files. And then you would restore it to the last backup file date and time. Result export. This is where you can basically set up what we'll call electronic printout. It creates a PDF of the test results, and you can create a PDF for every test result or for every test run. So say you're running 50 tests. If you choose it for every test, you would get 50 PDFs, or you could have one PDF with 50 results on it. So that allows you to have something there. You could then store that in a network folder as well. And then if you needed to print that out for some reason, you could print that from your network printers at that point. The last one on here is templates. And this just shows you the location you can import templates. And we're going to get into templates in another minute here. And you can import them using a USB or from a network folder. And then they would go into the templates database that's on the system. Okay, I'm going to exit out of that. So next, since we talked about data management, I just want to talk about networking here, talk about the ways to connect the system for the data management systems. So for our networking connections, we have a LAN network, obviously a local area network. And this is where you would set up your network so that you could set up those network folders so that you could have everything sent to whatever network folders you wanted to. Again, IPT people would take care of that for you. We also have an OPC UA connection. OPC U8 connection gives you a little bit more control of the instrument if you're going to use that. It allows you to stop and start the instrument remotely. It allows you to send data to the instrument remotely and send files to the instrument like templates. So it gives you a little bit more control of the instrument from a remote location than a LAN network is strictly for downloading data from the instrument to the network. Finally, we have the web server. What this is it's, if this was connected to a network, you would have a web address, or your IT people would assign an address to it. Once that address is assigned, you could sit at your desk, you could log into that web address, and you could view the data on the instrument from a remote location, or from your phone or wherever. You could type that in, you could see. So if you were out of the laboratory and the instrument was running a full plate 96 tests, you wanted to see how it was going, you could log in to this web address and you could see the test results as they were being run. Okay, we get users. Okay, let's just talk quickly about controls. So this is where you would put your controls into the system that you're using to verify your system or to bracket your samples, or whatever other controls you wanted to use in the system. You can see we have 2 in here right now. And what this allows you to do is not only to look at your controls, but you can then chart your controls. No data. Okay, let's try the other one. No data there. Okay, I thought there was data in here. Anyways, if you had data in here for any of these controls, you would be able to chart it and then watch if there's any trending of those controls. What you would want to do then is see if you're trending high or low, or see if you're getting good accuracy. This would be one indication as to whether you would need to calibrate the instrument. Again, we don't believe calibration should be needed much more than once a year, but it's a way to track that with the data you have here. The other thing you can do here is you can set an action limit on the system. So what this allows you to do is if you're going to set a warning, let's say, you choose 1 standard deviation, 2 or 3 standard deviations, and you say if that control is out of that range, I want to issue a warning, or you can actually stop the instrument from running at that point. So if you decided that if your controls were out of range, you didn't want to run any tests, you could set this up, and if you ran your controls first in your plate and they were out of range, it would stop the test from running, issue a warning on the screen, and then you'd have to go in and take care of whatever the situation was. I'm not going to change that now, but that's an action limit. You can add controls easily here, and you can edit controls, you can delete them. Again, all the databases have unlimited storage, so you can just keep adding controls as necessary. Okay, so controls, data management system. Okay, so that's everything on this screen here. 2 things I want to talk about before we move on to the actual demonstration of how the instrument works is, one, I mentioned templates and loading templates into the system. So we'll enter into this menu, and this is where you would set up each plate and what samples are in the plate, how those samples are loaded, what they are, if they're samples, so the purple shows it's a sample. If it was a control, it would be blue. So what you're able to do here is set up a template based on your type of testing. So maybe you're doing 48 tests, you would do half the plate, you would set them all up, you would put the sample IDs in. So if you were to do your own here, you could do it. You could do it manually here, then you would tell it to enter the sample IDs, and you could save it. And then you could tell if it was a control, it would change it to blue if it's a control that's in the system already. So if it was a control that's built into the system and you put that sample ID in, it would automatically turn it to a blue color for you. So you can do it that way, or as I said, you can upload these from a network folder or from a USB, and that's the way most of our customers do it. They set it up in an Excel format, or it can also be done in a text format. But the user guide explains how to do that and upload those into the system, which makes it much easier to do the layout and get your sample IDs into the system that way. Again, unlimited data storage. And then the last thing I want to show you before we move on to the actual testing is the events database. And I talked about the audit trail and the ability to have that audit trail available to you, and why that's important for data integrity and security is the audit trail always stays on the instrument. It never leaves the instrument. You can't delete it. You can't alter it. You can't edit it. You can't do anything to it. So all of this data is always stored on the instrument here. And you can see shows I logged into events, I logged into templates, I logged out of templates. So it shows everything I've done over the last few minutes here while talking to you. If I had made any changes, it would show you what the change was, from what state it was in to what it is now, the change I made. It would also show logins and logouts to the instrument and anything else. So all of the data, again, is stored here in the instrument, and it stays on the instrument. It can't ever be deleted or edited or changed at all. And that goes for the audit trail and the results database. Obviously, users and controls, you can take users off or make them inactive. Controls you can delete when they expire. But the important data of results and all the configurations and changes to the configuration of the system are stored on the instrument and can never be deleted or changed. Okay, so I think events results, yep, I think that's where we want to stop there. I already talked about calibration only being needed once a year. So now we're going to move back over to our consumables here, and we're going to prepare to run a test. So what I'm going to do here, first of all, is I'm going to get a pipette tip, and this is a 40 microliter pipette. I'm going to take my reference solution, open that up. I'm going to wet my pipette. And I'm only going to run one test here. So I'm going to put my sample into 1A here. And we're going to do that. So now, excuse my arm there. What we need to do is we need to put our evaporation cover onto the plate. Now I understand there's only one test in there, but we will reuse this plate many, many times in the future. But so you can see it has these two little tabs on the side here, so I can hold on to it. So what I need to do now is turn it over, peel the backing off, and you can see all the little holes, I hope, there. And what I need to do now is align it on the plate. Try and do this without getting too many of my hands in the way here. So I line it on the plate. I want to press it down to make sure I've sealed it well. We have this handy little roller we supply. Just roll that over the top. Make sure you've sealed everything really well. You then remove the tabs on the sides here. And now we're ready to put our plate into our instrument. So back over to our instrument. So now we have our plate here. It has the barcode on it, which you can't see. There we go. We have the plate which has the barcode on it here. The barcode needs to face the back of the instrument for testing because the barcode is read by the instrument, verifies the plate. It will also, if you're going to keep the plates, you're not filling them up, it will remember how many of the positions have already been used. And that way, when you put it back in, it'll know where to start again, or it will know how many empty positions are available so that you can put those in the test. Okay, so I put the plate in. I'm going to hit the load button. Sorry, enter. As you remember, I had usernames and passwords turned on, so I have to enter my username. You can see this went to yellow now at the top. It says loading. So now the conveyor will move the plate into the system, reading the barcode. So it's verifying the plate, ensuring that we have the right plate in there. You can see it now cleared the screen from the last plate that we had in there. Now there's a couple of ways we can choose which well is going to be tested or wells are going to be tested. I can just go in and pick wells like this, and then I'll uncheck those. Since I'm testing in this one, I'm going to pick this well. The other thing we could do is we could load a template in here. We load the templates in the next step, and I'll show you where that will be done. So now that I've chosen the well that I want to test, I'm going to hit start, and I'm going to go to another screen here. What this screen does is it asks me what kind of testing I want to be doing. So do I want to dispose of the plate after test? No, I'm only running one test. I want to have all those wells available to me later. I'm only running one replicate per well in this particular case. I'm not doing continuous testing. Continuous testing means I would load a second plate here on the deck, and then after the first plate was done, it would load the second plate and run the full 2 plates back to back. Remote control mode, I'm not in remote control mode. Select to enter sample IDs. As you can see, it says manually. I cannot choose the template right now because I've already chosen which well I want to test. If I wanted to use a template, I would have just left that last screen empty. It would have come over, I would have hit the use a template, I would have chosen the template I wanted to use, and it would have loaded the template in there. Select indexing option. I'm using the 1A indexing option for the positions. The next thing I'm going to do is hit next. It's going to ask me for my sample ID. So I'm going to put in 290 because that's the reference solution we have put in there. And then I'm going to get ready to, I'm going to hit enter. And then you should be looking inside the instrument now. So now you can see the pipette coming into the well. It punctured through the evaporation cover. It's going to go in. It's going to do a wetting so that it wets the pipette just like you would do for good practices with a manual pipette. It's going to draw up the sample now. It's going to move over here. This turntable is going to turn and pick up a sample cup out of this tray here. You see the sample cup move in. It's going to lower into the sample cup and pipette the 20 microliter sample in. Once it does that, it's going to move over and start cleaning. You can see this is the cleaning reel from the sample probe previously. It's homing itself right now while the pipette is cleaning over here. Once this gets ready to go, the sample cup will move underneath the sample probe, and then the sample, as you see, it just moved underneath now. The sample probe will lower. There we go. And it'll start the testing of the instrument. So now we'll come back to our screen here. So you can see now our status bar has started counting up. It shows that we're testing position 1A or A1. It shows at the top here, we're in testing. This is where our result will be. And once we get to so all of our instruments are freezing point depression. So right now we're driving the temperature down below its freezing point. And we're driving it below its freezing point, below 0 degrees C. And once it gets to a set temperature, we're going to initiate the freeze buzz. The sample is still liquid at this point. So you're going to hear that knocking sound that crystallizes the sample. It releases the heat of fusion then. And then once that happens, we wait for it to stabilize. And then we display the result in the results screen. Should knock about right now. Come on, there we go. There's our knocking. So now the temperature is coming back up to it, or its sample's coming back up to its freezing point. It's going to stabilize. We'll read that out, and then it'll complete the test. We'll push the plate back out, and we'll be finished with our testing. 287 plus or minus 3 is our range on this instrument, so we're within range. Although on the low side, this one, you can see it's turned green because it was a good test result.
Rick, we have a few questions that came through. Do we want to answer them now?
Sure, we can answer some of them now.
All right. So one of the questions is, could the samples be recovered for other study after the test?
No.
Okay. And then same question twice. Can we use any 96 well plate, or does it have to be from your brand?
It has to be our plates because the barcode is required to be able to identify the plate and assure that which samples are being used, which wells are being used, and which ones aren't being used, and so that you can reuse the plates.
Perfect. Thanks. That's all the questions we have for now.
Oh, that was it? Okay, that was quick. Okay, so you saw that the plate came back out here while we were doing that. So we recovered our plate again so we can reload it with more samples. Now, the last thing I want to do here is show the results database, and then we can get to some more questions at the end here. So this is our results database. Again, you cannot edit this, you cannot change it, you cannot delete it. You can only do a couple of things here. One thing you can do is you can choose several test results here, like I did, and you can run statistics on those. And you can see the mean, the standard deviation, and the CV here. You can export that if you want, or you can just exit out. You can see like there are several errors here. Those are just me canceling tests, and it shows you that the test was canceled there. So it shows you the cancel, or it shows you the plate ID that was used. You can also, let's clear those. You clear those by hitting that little button up there at the top. You can also search the database with the little hourglass or the little magnifying glass. You can search by sample ID, user ID, signatures, dates, times, whatever you want to do. So you can choose to search by, say, sample ID, and then you can export those if that's all you want to export, those particular samples. You can see it gives you the sample ID, the test result, the date, the time, the position, user ID, and then description. If you had the review and approvals on, this is where you would do your review and approval. So you would select a result. Yeah, no, let's get rid of that. Select the result, and then you would hit the sign button that would highlight for you. And then you would go in and you would sign it and add a comment if a comment was required. Once it's been signed, it would then download that to whatever your file location is that you're sending your database to. So if you're using review and approval, it doesn't send the data to your backup file or to your file on your network until it's been reviewed or approved. That's important to know, because if you leave them here unapproved, they'll never get to the backup file. So let's clear that out. The other thing, you can export the data, as I say. So basically, you could reprint them or export them, however many you want. So that's your database, your results database for you. Okay, so I think we have covered everything I'd like to show you today. So if there's any further questions, I will be happy to answer any further questions that you might have at this point.
Feel free to type any of your questions in the chat and we'll read those out. Is the instrument able to work with plasma, urine, and tissue samples?
So plasma and urine, no problem. Tissue samples cannot be worked with. Tissue samples, we have to have a liquid sample to test. So we can't work with tissue samples.
Thank you. Feel free to type any more questions. And if you do want to ask a question out loud, just raise your hand or type it in the chat, because I think I might have to unmute you for that. All right, we have another question. Is there any contamination issue after running for months? I noticed the injection will rinse multiple times before injecting, but if the sample contaminates the syringe, what is the best way to suspect and handle it?
Okay, so there is a cleaning procedure for the pipette and the sample probe that's that you should be doing on a routine basis. I believe it's maybe monthly. But other than that, there's no other maintenance that needs to be done to affirm. We've run the testing on the instrument. We've run it with the cleaning solution. We have never seen any contamination issues. with the pipette. If there ever was any type of contamination issues or you suspected contamination issues, we tell you to talk with our technical service people, and they would have a process for clearing that out.
Thank you. So the next question is if they can have a recording of this. And yes, this session is being recorded, and we will send that out after the session. Next question. The plate is reusable until you have used all wells once. Do you have to replace / get a new cover each time?
So there's, what did I say, 22 covers in the, yeah, 22 covers. So there's basically, we've set 2 covers per each, but so the answer to that is I've been able to peel it back and replace it. So depending on how many tests you're doing, you can probably reuse a cover a couple of times before it stops sticking well. But I suggest, depending on the number of tests you're running, you might need to replace it, after maybe 2 or 3 times. I suspect if you're only running a few tests at a time, it's gonna need to be replaced at some point because it'll stop sticking well, and you want to make sure you don't have any evaporation.
So is there no need to do dilution for samples less than 2,000?
That is correct. Anything under 2,000 should be able to be run on here without any difficulties. I will make one caveat to that. It depends on the viscosity of the sample. The pipetting system has a viscosity limit of 30 centipoise, and that's the thickest solution it can pick up. So if you have a very highly concentrated solution or a very viscous solution, even if it has a low osmolality, if it's above that 30 centipoise, then you might need to dilute that.
Feel free to continue typing your questions in the chat, or if you want to ask any out loud, just raise your hand. How long does it take to run a whole plate?
Oh, thank you for asking that question. I forgot to talk about that. So it takes, for a whole plate, it takes 3 hours and 40 minutes to run a full plate. It's a full 96 well plate. Thank you for asking that. I forgot to talk about that.
Next question, does the particle in the urine affect the test?
It won't affect the test results. However, if there's particles in the urine, it could affect the pipetting. And that's something that if there's large particles in the urine, you may want to spin that down to ensure that those particles are not in there, because that could, going to the contamination issue or something like that, that could clog your pipetting system if you're drawing small particles up into it.
Thank you. All right, next question. Could you go through the maintenance and maybe estimate the cost that includes calibration and PM?
So the maintenance, there's basically very little maintenance. It does most of the maintenance itself by cleaning between the probes and cleaning the pipetting system out after every test itself. Like I said, there's another cleaning step which is used to clean out to do a secondary clean to the sample probe, and that's about a monthly basis. As to the costs of PMs and calibration, I will suggest that you get in contact with your local representative and they can give you that information for a particular system.
Perfect. Next question, do you have another model to test samples at 1,500 to 2,000 with 20 samples only without using the 96 well model?
The answer is yes. We have the OsmoTECH Pro, which is a 20-position turntable instrument where you could load up to 20 samples at one time, and it also is 0 to 2,000 milliosmoles.
Perfect. Next question, is it better to do centrifugation for all samples before loading?
It all depends on the type of sample. The majority of the samples that we test in the bio industry don't need centrifugation. If you're talking about serum or urine samples like that, since that's been brought up here, I would suggest centrifugation for those type of samples, yes.
All right, we still have a few minutes left, so feel free to keep typing your questions in the chat, or if you'd like to come off mute and raise your hand and ask a question live. Maybe, Rick, while waiting for more questions, maybe briefly just talking about the OsmoTECH XT, in case there's anyone who has samples beyond that 2000.
Yeah, since we've been talking a little bit about the 2000, we do have the OsmoTECH XT. I did mention it briefly in the presentation. The instrument is a single sample instrument, runs one sample at a time, has a range of 0 to 4,000 milliosmoles. It's broken down into two different ranges, a low range, which is 0 to 1,500, and then 1,500 to 4,000 is the upper range. It's optimized for highly viscous and complex samples. So as I mentioned, if you have samples that are more viscous than 30 centipoise, it might be something you want to look into anyways, because it is optimized for those types of samples, which high concentrations of proteins or sugars, or if they're using cryopreservatives in any of your samples. The OsmoTECH XT has been designed to work with those at those high osmolality ranges and values to assure you get precise and accurate results for those types of samples. And it has all the same features from a data compliance and integrity standpoint as the OsmoTECH HT here. Basically, any of the instruments we've talked about so far today, the OsmoTECH Pro, the OsmoTECH XT, have the identical features here in the way they're set up, with users, restrictions, network capabilities, review and approvals, all the same on each one of the instruments.
Thanks, Rick. We got another question. What is the major difference between the HT and the OsmoTECH Pro?
The major difference is the automatic pipetting of the sample into the sample cup from the 96 well plate. The OsmoTECH Pro has a slightly larger sample size of 30 microliters into the sample cup, but the main difference there would be you have to manually pipette that yourself into each sample cup. Here we're doing it all for you from the 96 well plate into the sample cup.
All right. Any more questions? All right.
Okay.
Doesn't seem like there's any more for now. So if anyone has any questions following, we can always follow up with those as well.
Yep. Any questions you have, please reach out to either your local account representative, to Carly, and we'll be happy to get you any answers you need. If you'd like further details on any of the other instruments we've talked about, please reach out to your local rep or Carly, and we'll get you that information. So thank you, everybody, for your time today. I appreciate all the questions, and you all have a great afternoon now. Thank you.